Alright, so I'm arriving on scene. The scene is safe. I have my BSI on. We have one patient here down. Mechanism of injury seems to be a gunshot wound. So at this point, I'll call ALS and have my partner hold C spine. Now, my general impression of him is that he's a late 20-year-old male lying supine on the ground. So at this point, I'll go ahead and check his responsiveness. Hey man, you okay? No response. No response to a trap squeeze as well, so he's completely unconscious. I can't determine chief complaint because he is unconscious, can't answer any questions. So now I'll just go ahead and look for any life threats. So I'll cut his clothes off, cut right down there and here, and then I will scan his body head to toe. Looks like he has a gunshot wound in his right quad, so we'll have my assistant or my partner come over and help me use an occlusive dressing. We're gonna tape it on 3 sides, and then after that, I will look for his air, or look to see if his airway is okay. He's unconscious, so he's likely going to need a airway adjunct. So I will go ahead and do a jaw thrust, and my partner will put in an OPA. I'll check for breathing, checking for rise and fall, listening for breath sounds. Looks like he's going at 20 breaths per minute, but or it looks like he's going at 30 breaths per minute, sorry. But he is very shallow. So we'll have my partner go ahead and put a BVM on him and bag him at 12 breaths per minute. Then we'll check for circulation, so I'll check his pulse. He's tachycardic, 130 BPM. Then I will check for any major bleeding. So we'll do a quick head to toe blood sweep, going under his legs again. Looks like going under his feet again as well. So that is okay. Let's see. I'll also check his skin color. He's a little bit cyanotic. It looks like his skin is also cool and clammy. I'll also, let's see, so we'll treat him for shock. So he's in a stable position. We'll put a blanket on him to help him conserve his heat. So now I will decide to transport him because he's a 3 on the GCS scale, pretty damn low. So we'll transport him. We'll get that ready. We'll have someone get a longboard. Let's see. We will attempt to perform a sample history, but likely to no avail because he is unconscious. So now we will do a secondary exam. So I'll check the head or area around it for cerebrospinal fluid. I will push down on his mandible, push down on his facial bones and his cranial bones, looking for decap BTLS crepitation. I'll also check his eyes, his pupils with my light, looking for dilation and constriction appropriately, and bilateral evenness. Let's see. I'll then move on to his neck, looking for tracheal deviation, jugular distension, also palpate his cervical spine. Then we'll move on to the chest, so I'll start by palpating bilaterally on his clavicle, go right down his sternum, then we'll auscultate. So we'll auscultate bilaterally, clavicle, below the nipple and mid-axillary. We'll then move on to the pelvis. So we're going to palpate each of the 4 quadrants, looking for rigidity, tenderness, also decap BTLS crepitation. We'll also do a genital sweep, looking for periaprism in men and hemorrhaging in female and women. We'll also push inward and down on his pelvis, checking for decap BTLS crepitation. We'll then move on to his legs, palpating his legs down, looking for decap BTLS crepitation. We'll also check his pulses on his feet. We'll also, for motor, we'll ask him to wiggle his toes. For sensory, we'll squeeze one of the legs and ask him which one we're squeezing. Then we'll move on to the arms, basically the same thing. Palpate each arm, looking for decap BTLS crepitation. Then we will, from motor, ask him to wiggle his fingers on each side. Also, to ask him to tell us which side he feels pressure or squeezing on. And then we'll check pulses on each side. Let's see. Then I'll ask my partner to come. We're going to roll him over, check his back, and then on the count of the person who is holding C-spine, we'll roll him over. So now we're checking his back, we're checking his thorax, his lumbar, and his buttocks, all for a decap BTLS crepitation. Looking for rectal bleeding. Let's see. So we'll palpate here. Thorax, palpating that. We're also looking for any exit wounds. Let's see, any additional life threats, any secondary injuries as well. We're checking for all of that, such as the gunshot exit wound. So now that my partner is back with the longboard, we're going to transport him. Going to put him on the longboard, and then we are going to take him into the ambulance, where we will then take his vitals again. So we're going to do a blood pressure, a respiratory rate, and heart rate. And then we will reassess him every 5 minutes because he is unstable. Hopefully he gets better.